Good morning. Good morning. Good afternoon, everyone. Today, I am going to present a topic on cathartics, which are important pharmaceutical agents used in medicinal practices. It's okay. We have discussion about topics. Next one is definitions. Cathartics are used to relieve constipations or bring our defecation. The term laxative is used for the mild cathartics, whereas purgatives used for strong cathartics. Laxative, purgatives or cathartics are substances that loosen the stools and increase the bowel movements. They are used to treat and prevent constipations. Constipations is the infrequent or difficult evacuation of the fecus. Okay, first let us understand what is the cathartics. Okay, cathartics are substances that promote bowel evacuations. They help in relieving constipations and cleansing the intestine before the certain medical procedures or surgeries. Okay. Next, laxatives. Laxatives means that it will be milder actions, elimination of soft but formed stools, onset of actions 12 to 72 hours. Okay, next one is purgative. Purgatives are moderate laxatives, onset of actions 6 to 8 hours. Next, cathartics. Stronger actions resulting in more fluid evacuations, onset of actions 0.5 to 3 hours only if you are taken orally. Suppose you are taken rectally, means 2 to 15 minutes okay only. Okay, laxative should only be used for short-term therapy, as prolonged use may lead to loss of spontaneous bowel rhythms, upon which is normal evacuation depends upon causing patient to become dependent on laxatives. So this is called laxatives. Okay, cathartics are mainly used when normal bowel movement is difficult, because they increase intestinal motilities or help in retaining water in the intestines. Okay, which is soften the stool and promotes easy excretions. Okay, because cathartics are mainly used when normal bowel movement is difficult, because the increased intestinal motilities are helping retaining water in the intestines, which softens the stools and promotes the easy excretions. So cathartics are mainly used for this purpose. Cathartics are broadly classified into different types of based on the mechanism of actions. First one is we are going to discussion about four types of classifications are available. First one is stimulant, second one is bulk purgatives. First we are going to discussion about bulk forming cathartics. These include substances like psyllium and bran. They absorb water in the intestines and increase the stool volume, which stimulates the bowel movement. And they are considered commonly used chronic constipations. Okay, means bulk purgatives means these are the agents which increase bulk of intestinal contents. They are cellulose which swell when wet or due to increase bulk stimulate peristaltis. Example, methyl cellulase, sodium CMC, isopcal. Okay, this mainly the bulk purgatives they commonly used for chronic constipations. Next one is we are going to see about stimulant. In this the drugs or chemicals act by local irritations on intestinal tract and bring stimulations of peristaltis activities. Since they act on intestines and stimulate peristaltis, they are also called stimulants. Okay, examples drugs like chenna, rhubarb, cascara, podocilium, astiles, aloes. This one is the stimulants. Cathartics include one senna and castor oils and bisagodil also we are used for the stimulant categories. These drugs directly stimulate the intestinal muscles, leading to increased peristalsis and bowel movement. Suppose we are taken on the chenna or castor oils and bisacodyls, means these drugs are directly stimulate the intestinal muscles. For what purpose? Means increase the peristalsis movement and or bowel movement. Okay. Next one is saline catharatics. Saline catharatics is fourth category or third category, are also known as saline catharatics. It acts by increasing the osmotic load of intestines by absorbing large quantity of water and thus stimulate peristalsis. The saline catharatics are water soluble, mainly inorganic chemicals. Okay, they are taken with plenty of water. Okay. Next one is the saline catharatics is other name also osmotic catharatics. The examples வந்து magnesium sulfate, magnesium hydroxide and electrolysis. The three types of examples present in saline catharatics. These agents draw water into intestines through osmotic actions. For what purpose? Means which helps in stool softening and bowel evacuations. Okay. Next one, lubricants. Lubricants substance like liquid paraffin, glycerins, mineral oils, extras act as a lubricants and bring smooth clearance of the fecal materials. If you are taken liquid paraffin or glycerins and mineral oils, means it will bring out the smooth clearance of the fecal materials. Examples, we are going to discussion about the examples of for catharatics. First one is bulk farming. For bulk farming examples, dietary fiber. Example, isoflavono or flandago, methyl cellulose. Isoflavono and methyl cellulose are bulk farming catharatics. Next one is liquid paraffin and DOS or doxides. This is stool softener for. Okay. Next one is chenna, sodium sulfate castor oils. This one is under stimulant purgatives. Next one is magnesium salts like sulfate and hydroxide. These and all osmotic comes under osmotic purgatives. Next one, sodium salts, sulfate, phosphate, sodium, potassium, tartar, lactose. These and all comes under osmotic purgatives under the sodium salts. Next one is we are going to discussion about examples of cathartics. First one is magnesium sulfates. The magnesium sulfate of molecular formula MgSO4 7H2O4. Molecular mass 125.36 gram per mole. Okay. Next one, this is the magnesium sulfate or structures. Properties means this appearance will be white crystalline solid. This water will be like waterless. The taste will be like bitter taste. The melting point of magnesium sulfate is 150°C. Solubility 113 gram per 100 ml at 20°C in waters. So slightly soluble in alcohol also. Okay, it will be slightly soluble in alcohol. Next one is magnesium sulfate. How will be prepared by laboratory method? First one is magnesium sulfate is prepared from magnesium carbonate and dilute sulfuric acids. Okay, how will be means magnesium carbonate will be taken and then add a dilute sulfuric acid. It will come formation of magnesium sulfate. The water will be eliminated, carbon dioxide also eliminate. Okay, magnesium sulfate can also prepare from magnesium oxide and dilute sulfuric acid. Next, second one is magnesium sulfate. Another method also prepared magnesium oxide. Oxide also dilute sulfuric acid. Magnesium oxide plus add dilute sulfuric acid means it will formation of magnesium sulfate will appear. Water will be eliminated. Next, industrial method. Magnesium sulfate is prepared from dolomite. Okay, by using dilute sulfuric acid. Next one is magnesium sulfate uses. It is used to asthmatic laxatives or other name is saline cathartics. For what treatment will be means electrolyte deficiencies. In wet dressing in boils, the treatment of cholestasis C sickness. Okay, the magnesium sulfate storage will be tightly closed containers. Dose how it will be taken means daily per day you want to take 10 to 15 gram per day only. Okay. Constipation, suppose catharatics have several therapeutic effects. They are used mainly on the for treating constipation, mainly like a diagnostic colonoscopy and removing certain toxins in poison cases. Okay, however, improper it may cause one the several side effects also. First one is dehydrations. Body will occur dehydrations, electrolyte imbalance. After dehydration means automatically electrolyte imbalance will be occurs. Next one, abdominal cramps. Some cramps like the in abdominal you have some cramps also, and dependency. There should be carefully under medical supervision only we can use catharatics. If conclusions, catharatics play a mainly important role in bowel health. They are mostly widely used in clinical practice. Okay. Thank you.